and welcome to The Nation. I'm your host, Sonia Aisha. Now, everyone has the right to a workplace free from bullying. Workplace bullying is harmful, targeted behavior that happens at work. It might be spiteful, offensive, mocking, or intimidating. It forms a pattern and it tends to be directed at one person or a few people. This is a persistent pattern of mistreatment from others in the workplace that causes either physical or emotional harm. On today's episode, we'll be talking about bullying in the medical fraternity, and to discuss this further, Hetal Doshi, organizational psychologist, joins me. Welcome, Hetal. How are you?
I'm really good, Sonia. Thanks for having me.
Great. Such a pleasure to have you in the studio with us today. And talking about bullying, especially in the workplace, is becoming more and more prevalent these days. And most recently, we've heard of the suicide case and the death of a houseman. Yeah. But I think before we dive further and into this topic, perhaps you can start off by telling us, how do we define bullying in a workplace?
Yeah, and maybe before that, I'm not sure whether it's becoming more prevalent or whether we're vocalizing it a lot more. I do feel that over the past decades, there have been a lot of measures to mitigate bullying in the workplace. I'm not sure whether it's increased, but definitely vocalizing of it has significantly increased thanks to social media platforms as well. So bullying is a dysfunctional and a destructive behavior that typically occurs in a context where there's possibilities of psychological or power imbalances. So that needs to happen. The environment needs to kind of condone or allow or probably justify the need of power or hierarchical imbalances in the workplace. Also, it leads to an imbalance of a point where the person receiving such a treatment begins to feel more and more helpless over a period of time. And this learned helplessness puts them in a position where they often feel that there's nothing else that they can do except to probably withdraw from that situation altogether.
Right, you're talking about withdrawing from that particular situation. What are some of the avenues, that victims can actually go to when it comes to the bullying cases?
Yeah.
I mean, of course, the last thing we want is for them to resort to suicide, right? But in terms of support or, perhaps, changing jobs as well, changing their career aspirations, would that be an option?
Yeah, I think there are many options. I think I would definitely say the first option is to choose not to be helpless in that particular situation, and to ask yourself that very famous question that I always talk about, which was promoted very well by the Spice Girls, is what do you really want? So in that particular situation, sitting down and thinking about what do you really, really want in that, considering that you have this big profession that you've signed up for, but you also want to be in the right environment, begin to open up all of your options. Maybe this is not the only option. And I think that's the proactive and probably the more constructive way of approaching it. However, in a situation like that, you kind of need to find your balance all over again because you feel very imbalanced from being treated in that way. So support systems are very important. And in fact, over the weekend when we were talking to housemen, junior doctors and medical officers who are very senior, they were talking about the importance of having third-party support like counselors or psychologists within the workplace where there was anonymity and there was no stigma attached to it, but also at the same time having internal mentors or supervisors that were not your immediate bosses that you could go and speak to. So having a very, a well thought out, proactive third-party support system to help you find your balance all over again, and then to figure out what is your next plan of play would probably be the best way forward. But definitely the one thing that I would hope nobody ever resorts to would be that feeling of learned helplessness where you learn that this is the only way that you can be in situations.
Exactly. I couldn't agree more with you when it comes to reaching out for third-party support. But of course, you mentioned it's so important to empower them. But how do we make sure that they're willing to even take the first step, right? So because oftentimes we think this is a normal right, that's happening in your workplace. Yeah. I mean, if you look at back then, talk about the past decade, even in school, it's normal to punish someone, to cane someone, right?
Yeah.
But of course, today it's deemed
inappropriate and probably
right?
illegal.
Exactly.
Yeah.
So, how do you ensure, they're brave enough to take that first step, right? I think creating that awareness that they're not in this alone.
Yeah. I love that you use the word brave, and it's also sad at the same time that we need to be that brave in order to do what is right or to, take on this employee rights as not privileges but basic rights. One of the things that have been done really well over the past so since 1965, we've had a psychologist called Anne Edmondson, and she's spoken about psychological safety in the workplace, and she started out doing experiments within the medical fraternity. And the idea of what you said earlier, bravery, was the final and eventual outcome of safety. So how do you create safe conditions for the major reason of people being brave enough not only to step up and say things that are not right about the organization, but also not right about processes and procedures that could cause patient death. So you could imagine if a person or a houseman, junior doctor, is not able to voice out that they are not being treated right. Do you think they would be able to voice out that a patient is not being treated right? So that level of safety is critical. And there is a wave of what we call psychological safety as important as patient care safety for the idea of bravery. So in this particular experiment that Anne Edmondson ran, she found out, very ironically, that organizations or hospitals that reported more mistakes, more bullying, more issues actually ended up having better performance and better well-being than hospitals that reported less. So this was kind of totally against what she was expecting. You would think that, okay, if there's like less reports, the organization's probably doing better. But in that case, an organization that had a lot more safety for reporting and a lot more confidentiality and anonymity around it, they used all of that data to improve themselves and create better conditions, not only for the staff, but also for patient outcomes as well. And they found that in those situations, there were less death rates.
Exactly.
Yeah.
And of course, like you said, creating more awareness and I think rightly put it, having more open dialogues.
Yeah.
For example, now online, there's a forum for people to actually share their stories, right, and experiences they had when it comes to bullying. But looking at the case today, the amount of bullying, like I said, it's so prevalent. Do you think it's more of, younger generation being strawberries? Or do you think it's also accumulation of the stress from COVID, the burnout, anxiety, that's all come to this point?
Yeah, I think the name calling has become one of the major reasons how the perpetrators could be protecting what they deem is necessary for the professional competence to be kept at a certain level. So you use name calling to say that you're not up to a standard. But then you could have the strawberries calling the older generation extinct dinosaurs. And what would this name calling do to each other when in actual fact, the strawberry generation or the millennials or those born, I guess in the 25 to 30 age over here, their parents would have been the ones that created them. And so therefore, the reason why we are the way that we are is because of the generations before us as well. So I think the first thing to do is to kind of eradicate the name calling, because that is just a defense mechanism to take real action to actually listening to each other with very high levels of respect, which is part of psychological safety. You need to have that safety, but that safety, the first step of safety is inclusion, meaning it is us rather than me versus you, strawberries versus dinosaurs. Both of us need to appear as one collective team that need to work with each other to be able to score goals in a way that we can all celebrate with that achievement at the end of the day, and we can all also feel sad when things don't go well as a collective. So I think the first thing to do in situations like this would be to eradicate the name calling, label that as a defense mechanism, start off the safety process with inclusion, and then very important part of it is learning, deep learning, and then contributing and then challenging. So you're not just challenging straight away and saying you're weak or you're old, but listening, learning, contributing, and then together challenging to something even better as a system going forward.
Great. Well, thank you so much, Hadel. We're going to have to take a quick break. Of course, when we come back, we'll be talking more about raising the awareness of bullying cases in the workforce. Don't go anywhere.
Ekosistem marin, termasuk terumbu karang, rumput laut dan hutan bakau, adalah amat penting dan memberi sumbangan dalam kemakmuran ekonomi, sosial dan alam sekitar. Nilai ekonomi yang boleh dijana daripada pemeliharaan ekosistem marin di taman laut adalah 8.7 bilion ringgit Malaysia setahun. Bersama-sama kita lindungi dan memelihara kelestariannya. Jadilah pengunjung kawasan taman laut yang bertanggungjawab dengan mematuhi peraturan yang ditetapkan. Sertai aktiviti sukarelawan dan menyokong usaha pemeliharaan ekosistem marin. Kurangkan penggunaan plastik sekali guna. Peka dan menghargai kepentingan hidupan laut dan ekosistemnya. Amalkan penggunaan teknologi hijau. Lupuskan peralatan rumah dan bahan berbahaya dengan kaedah yang betul. Gunakan baju organik dan mesra alam serta tingkatkan pengetahuan mengenai ekosistem marine.
All right, welcome back to The Nation. Now joining me in the studio is Hadel. Now earlier we were talking about bullying cases in the workforce, right? And of course we were comparing the younger generation, whether it's a case of being strawberries or but moving forward, what do you think should be done to prevent these cases in the workplace?
Yeah, I think one of the biggest debates right now is whether there's a handful of medical professionals that are experiencing bullying or not, or is this like something that's pervasive? And I think the most important thing that we need to start off with is an evidence-based or data-driven approach to eradicating any kind of offensive behaviors, whether it's bullying, verbal, physical, sexual. So using a data-driven approach towards this. What I really mean by that is that there are actually global standards out there right now that medical organizations can actually begin to start utilizing. A particular standard that is out there right now is called the ISO 45003, which is about mitigating psychosocial risk in the workplace. What that really means is that as you begin to experience more unnecessary stress in the workplace, it actually begins to compound and it puts you into a state of harm, injury, or death. Back in the days, we were like mostly physical laborers. We were out there doing physical work, but we're now mostly doing a lot of psychological, emotional, social kind of work. And so how we used to measure physical injuries is how we can also measure psychological injuries. So in this particular model that we use with workplaces right now, we have about 20 factors that we look at from a psychosocial risk perspective. And you can actually measure that. And you can also measure in a climate like medical organizations or fraternities, the stress is very high. But at the same time, certain teams, even though the stress is very high, their well-being is very high. And that shows that they're actually doing something well. So what we do is we put teams in organizations into scatter plots and see how well they're doing. From this data-driven approach, nobody can then have an opinion-based idea about whether the climate, the organizational environment is good or not good. You're part of socially comparing yourself towards who you are, where you are, how you compare with your teams, and what the best standards are. This is what we have found has been the most helpful, because then there's no more opinions, there's just evidence about what you're experiencing. Then, of course, we use psychological safety to have conversations rather than slandering people to say, yeah, the workplace isn't good. And we take this as a proactive approach towards getting people to go higher and higher up to the North Star, or what we call the happy face of how workplaces can be.
Yeah, great. But do you think there's a difference between workplaces? We're talking about companies versus the medical field, right? Because it seems to be two different responses. Like people, some of them are actually agreeing this kind of abuse, saying it's necessary for practitioners, doctors in training, to go through this so that you're well prepared to handle the patients. So, do you think there should be a clear line or perhaps a parameter in terms of the bullying boundaries?
It just, I'm like in shock when people say abuse is a necessary part of doing this. I think like just the military. So I totally agree that the medical fraternity can and probably looks very different from a corporate industry, because you're talking about life and death, you're talking about very, very different hours, and the need to come to action far faster than any other industry, right? If you look at the military, for example, what they do is that when they do training, so in the military, they have a lot of veterans that end up having PTSD. So what are we trying to say? That abuse is important for them to be trained to be abused, and then eventually they're going to show up as abused people when they come out of the fraternity. Are we saying that that's like the smartest way of training? There are definitely better methodologies. First things first, if you're going to abuse somebody as part of training, you need to articulate that these will be the parameters of how they will be, I don't want to use that word, but how they will be trained. So you don't just verbally abuse people. I don't think sexual abuse or any of that sort of things would be constituting that it's okay. You would probably say, okay, this is part of your training. These are the things that you're going to be experiencing. You're going to be fully protected in that environment like this. You have safe codes, safe words to say that this is too much for me, and that we're able to pull you out from that scenario, do a debrief, and then help to prep you up again. So if it is a training, then make it like, a competency, something that you're building somebody up for as part of it, not something that you're building. They call it, I think,
I guess it's also like almost like building fear, right? Instilling fear in them to obey the rules, But of course, we've seen the most frequent types of bullying. One being asked to do work below the level of competence. This seems to be the majority of it, right? But like you said, there should be a clear data on like the proper guidelines, perhaps parameters that we can all follow through to ensure that we're not crossing the boundaries. But in the case of being asked to do work below the competence level of competence, or being humiliated or ridiculed, like I said, how do we draw the line or boundaries, right, to ensure that we're not actually crossing it?
Yeah, well, I mean, if you're asked to do something that is way below your level of competence, then I think you just really need to come into the fraternity knowing your rights. And I think one of the things that is, so when we did a study on psychosocial risk in the workplace, number one, it was work pace and workload. So the workload is super high. That's like the number one risk across Malaysia right now. The second one is work-life boundaries. And the third one is influence at work. So the inability to influence, or the inability to vocalize and negotiate and talk and converse about things is probably the third highest risk in the workplace. So I think training people to be able to speak up is critical. I have seen in situations, even where the supervisor and the leaders are open to listening, that people still have that fear of speaking up, potentially because of cultures that we are brought up in, or families that we are raised in, and the non-evidence-based fear or consequence of losing your job. So there are many leaders out there who say, I've always asked them to speak up and they don't. But I think there should be training on speaking up. So in the past, when we did, conversations on how to speak up to your bosses, at the end of the training, they would say, I think my bosses should attend the program. The bosses would say, I think my subordinates should attend the program. So what we have done is now we're creating simulations where the bosses and subordinates are actually present together and speaking up with each other in a very safe environment where they are rated, evaluated on how able they are to have these conversations. So we don't talk about speaking up, we talk about like, how do you actually have these conversations? And the training is based on both parties actually being there and being evaluated on how well they can do that as well.
Exactly. That's such a good point to highlight, actually. It's not just about encouraging to speak up, right? But you got to make sure the environment's also conducive, right? There's a proper platform to actually voice out your opinions. Now, all right, we're going to have to take a quick break. Of course, when we come back, we'll be talking more about bullying in the workplace. Don't go anywhere. Welcome back to The Nation. Now, Hero, earlier we were talking about some of the guidelines and ways that we can encourage people to actually speak up about bullying cases in workplaces. What do you think organizations could do? What are some of the best practices they could implement?
Yeah. I think the most important thing is something called the strength of your system in the organization. What the system actually constitutes would be, what is your policy in the workplace with regards to employee rights? The second thing would be, from the policy, making it enforceable. I think from what I've heard from some of the doctors is that there are policies, but it's not being enforced. What this also then means would be what are the KPIs of doctors and medical professionals? One of the KPIs that would be missing right now would be creating a safe environment, creating a psychologically safe space, or being able to have teams that are thriving. These KPIs are not part of how you're evaluated as a doctor, a medical professional, a leader or manager. It's simply not there. So if it's not measured, it's not going to be done, right? Then you also don't have from your KPI, if it's not there, then it doesn't help you with regards to promotions. You're promoting people based on other indexes rather than well-being in the workplace as well. You're also remunerating people not based on that. You're not creating consequences based on that. And so it just really starts from policies, making it enforced, putting it as part of your KPI, making sure that your promotions, consequences are all part of that, also your rewards. And lastly, making sure that there's a lot of training and awareness all around these policies and standards of psychologically safe places to work, reduction of stress and risk in the workplace, and increasing of well-being. They're two different things. One is to decrease the level of risk, one is to increase the level of well-being. These two are separate things, and I think organizations are only looking at increasing well-being, but not talking about decreasing the level of risk and stress. Just totally different, two different concepts altogether.
Exactly. So I think it should be a more comprehensive guideline. And like you said, it's not just about setting KPIs, but it's also ensuring that it's being enforced, right? The policies are being practiced. And talking about organizations, let's zoom out and look at the roles of governments and associations as well as unions. Yeah. What role do you think they can play in this matter?
Yeah, I think the first thing would be to create a benchmark and a ruler of how workplace risks or stressors are going to be assessed, and also how workplace and well-being is going to be assessed. These two things. So one of the things that we have looked at in further out of Malaysia, and in fact is being done in Dubai right now in a psychiatric hospital, and they're doing it really, really well, is to create this ruler. Like, for example, if you have diabetes, everybody knows how to measure that. There's no qualms, two ways about it. That is how it is measured. So right now there are standards in place. You've got ISO 45003, and in Dubai there is an organization that is guiding themselves to meet these certain standards. And I think this is the role of the government. I mean, I think what was shocking for me was the contemplation of how do we define bullying. We need to know how to define these things. We need to have it defined already, but we also need to know how to measure it. And the role of governments, unions, associations would be then to make sure that it's pervasive across Malaysia and beyond. And comparing ourselves to other countries, seeing how we benchmark ourselves, and doing everything with regards to listening and making sure that what we listen to is kind of applied and demonstrated through reports as well. So right now, there are task force out there that have been launched post what has happened with the Penang situation, but we don't know what the task force is going to be doing. We don't know how they're going to be measuring it. We don't know what the reports are going to look like. And then what happens after this? Do we wait for another massive incident to take place? What is something that is a consistent, consensual way of moving forward with regards to eradicating unnecessary psychosocial risk and burden in the workplace? And what is the right way of increasing well-being going forward as well? And that is a discussion that I know hasn't yet taken place. It is not a standardized, globalized way of measuring it. And until that is not done, I think it's going to be a very reactive approach going forward.
Great. Of course, that's a very good call to action that you're asking for. And of course, we've been talking more from the victim's perspective. What about the bystanders? There are some people who are actually witnessing all these happening around them, but they're afraid to actually speak up about it. So how do you think we can encourage bystanders to actually speak up without worsening the situations for the victims?
Yeah.
How do they play their roles as whistleblowers?
There's the major reason why bystanders don't speak up, and the reason why people don't speak up in general is because that means that there's going to be massive consequences to your livelihood, what you would be providing for your family, what you have studied so hard for. So what is the benefit of actually speaking up on behalf of someone? None. And so how do you encourage something that has very little reward, if at all any, and a lot more risk or consequences as well? I think it goes back to like what you were saying earlier about whistleblowing. I think the whistleblowing platforms, internal whistleblowing platforms, need to instill a level of confidence that is second to none. and it needs to be proactively demonstrated how the level of anonymity and confidentiality is actually promoted and leads to very good outcomes for not just victims or perpetrators, but also the entire organization at large as well. So I think until the system doesn't demonstrate that level of confidence in everybody, to force somebody to speak up with only consequences to what they're going to say rather than any rewards or incentives, especially when they're not the ones being attacked, I think it's a far cry to just getting someone to do something that it's just, you know, I may as well just jump off jumping off a cliff would probably give me a lot more benefit than doing something like this as well.
Well, thank you so much, Hadel. You know, I think it's been a great, insightful and sharing session with you, especially the call to action you've actually listed there. Of course, first things first is actually defining what bullying means, right? And of course, how do we measure it and comparing it with other countries. All right, well, thank you so much for tuning into The Nation. Now, remember, you have nothing to lose by being kind and teaching well. Bullying in the workplace has to stop. And please do not normalize harsh treatments. That's all on The Nation today. I'm Sonia Aisha. Thank you for watching.
Dos penggalak atau booster dose adalah dos tambahan yang diberikan kepada individu yang telah lengkap